don't really have any help. They didn't have any beds.
Also tonight, a Valley mom in need of surgery left waiting in an emergency room for more than 2 days, sleeping right there next to COVID patients as her surgery just kept getting delayed.
It is a reality inside our hospitals, and a story you'll only see on ABC 15. Our Zach Crenshaw live for us tonight.
And Zach, you just spoke to that mom a short time ago.
Yeah, we talked shortly after her ambulance ride from Banner Ironwood in Queen Creek to Banner Hart in Mesa. The mother of 4 finally transferred after roughly 48 hours in the emergency room.
I've done a lot of crying.
Jackie Ferrero went to the ER Tuesday evening.
I have a bunch of blood clots.
They weren't sending her home.
They said they were going to transfer me Tuesday night, and I would have the surgery Wednesday morning.
But Wednesday came and went.
They kept saying they don't know where I was on the list.
The mother of 4 languished in the ER.
I'm sharing bathrooms with people who have COVID. The beds are filled up. There's not enough workers.
She went long periods of time without even getting food or water from anybody at the place.
They kept not giving me food because they wasn't sure if I was getting surgery.
The surgery and food never came for Jackie and others like an elderly patient.
He checked himself out against doctor's recommendations because he says, I'm going to pass out if I don't eat. And he checked himself out to go get food.
Even people that don't have COVID are being affected, and I don't think people are realizing that.
There's just not the capacity personnel-wise to handle it.
Former State Health Director Will Humble says Arizona's current COVID surge is changing the standards of care.
Those are the types of people that aren't able to get the care and will continue to get pushed off as we press into the last part of December and into January.
Jackie knows long after her surgery, the ICU beds will still be packed and the nurses run ragged.
They're just overwhelmed.
She just hopes others are able to learn from her experience without ever seeing the inside of the ER.
Even though they hear numbers, I don't think that matters to people until they're actually affected or see it for themselves.
Now, I reached out tonight to Banner for comment, but have not heard back yet. But as we've reported, they are far from the only hospital system in the state experiencing a shortage of beds or staff. As Jackie told me, the head admin nurse had to roll up her sleeves today at the hospital and said, quote, "I just don't have enough nurses." Live tonight, Zach Crenshaw, ABC 15, Arizona.